Waardenburg syndrome is a rare genetic condition that mainly affects the skin, hair, eyes, and sometimes hearing. Think of it as a set of traits that run in families, like a family recipe that changes a little each generation. People with this syndrome may have bright colored patches of skin or eyes that look different in each eye. The syndrome happens when a child inherits a change mutation in one of several genes that guide the development of pigment cells and nerve cells. Most often, the change comes from a parent autosomal dominant, but sometimes it appears for the first time de novo. Imagine a blueprint for building a house. If the blueprint has a typo, the house may end up with a slightly different color scheme. Two different colored eyes heterochromia, or one eye that is lighter than the other. A white patch of hair, often a streak in the front. Light-colored skin patches, especially on the forehead. Hearing loss ranging from mild to profound. A slightly wider space between the eyes, dystopia canthorum. You can picture a child with a white forelock and one blue eye. That visual cue often alerts doctors to look for the other features. Doctors diagnose Waardenburg syndrome by looking at the physical signs and confirming with a genetic test that checks the relevant genes. Treatment focuses on managing problems: hearing aids or cochlear implants for hearing loss, speech therapy to help communication, regular eye exams if vision is affected, skin care for any pigment-related issues, though these usually need no medical treatment. The approach is like fixing each broken part of a car, rather than trying to change the whole model. Because the condition is genetic, there is no way to prevent it before a child is born. However, families with a known history can consult a genetic counselor before planning a pregnancy. The counselor can explain the chance of passing the gene and discuss options such as prenatal testing or pre-implantation genetic diagnosis, which are like checking the blueprint before the house is built. Recent research has identified additional genes, for example SOX10, MITF, linked to Waardenburg syndrome, helping doctors classify the condition into subtypes with more specific predictions about hearing loss. Gene editing technologies are being explored in the lab, but they are still far from clinical use. Meanwhile, improved cochlear implant technology and early intervention hearing programs